Hello, everyone. uh, we're gonna do a talk about Walant and foot and ankle. Mainly, we're gonna do why we use Walant in foot and ankle surgery. So, it is important always start asking you why. Whatever you do, ask always why. This is it comes from an idea from a book of Simon Sinek, and he talks about the golden circle, and they say about why, how, and what. So initially, we have to ask ourselves why we do this, and then how we do this thing, and then what are we gonna do. So some years ago in 2018, Dr. Lalonde come to Barcelona into our clinic, and then he teach us about the new thing called Walant. We just heard about this some months ago, but it was a pleasure for us to hear from Dr. Lalonde about what is this new thing called Walant surgery. And it was really nice, and it wakes our head, our mind. And then in the hospital in 2019, we had a problem. We had operating rooms, but we didn't have so much anesthesia stuff. So we thought, what can we do? We scratch our minds and we start thinking about options. And then we say, okay, let's go. So Dr. Lalonde has teach us about the Walant surgery. Why we don't apply this to our surgeries, to our hand surgery? So we start small, and then, but we were thinking big. So we initially start with little surgeries like trigger finger or carpal tunnel release, cysts, some little fractures, and the results were good. So we didn't need any pre-op test, no pre-op visit, no anesthesia staff in the operating room. The numbers of surgery were larger, and the setting of the operating room were faster. So the hospital manager were really excited about this idea, and everybody was seeing that this option is very good. And this is very important. This is a very important thing to start with the Walant. If you want to apply Walant in your hospital or in your clinic or wherever you are, because you will find a lot of resistance within your group, your like orthopedic group, or with the anesthesiologist, or with the nurses, or with the system. And you have to break this resistance. So after this initial hand experience, we say, okay, but I'm a foot and ankle surgeon. Can we apply this to the foot and ankle surgeries? You say, well, why not? Why not? So we start with simple cases like the mild bunion surgery, and we had good results. But then 2020, COVID came, and if we were without so many anesthesiologists in last year, in 2020, we're like very few anesthesiologists in the hospital because they were in the ICU, and we didn't had so much operating room. So we said, okay, this is our time. So we had a problem, difficult situation, and instead of thinking, oh, that's not, we are not gonna do this or the other, we said, okay, let's think and think about positive. So, well, I think thinking positive always leads to better things. So we think that's our time. Let's do the foot and ankle surgery with Walant. And we start doing foot and ankle surgery with Walant more and more with complex cases and complex things that years before we didn't dream about it. Thank you.